A very good morning to the Director of Policy and Research and our colleagues here at the Ministry of Health. Today, Casey, Kun Hang, Nazaruddin, Carrie and myself, Charmaine, will be presenting on mandating COVID-19 vaccinations here in Singapore. This will be our agenda for today. Without further ado, our thesis statement is for the COVID-19 vaccination to be made compulsory for those aged above 18 years old, with an exception for those who are medically ineligible, to ensure increased immunity while minimizing the risk of medically unfit individuals facing adverse effects of the vaccine. COVID-19 is a public issue that has not only impacted our local population but millions worldwide. As of mid-September in Singapore, there have been 74.8 thousand cases so far, 813 warded, 90 severe cases, and 14 cases in the intensive care units. These numbers continue to rise every day. Overall, COVID-19 has had detrimental impacts on a micro and macro scale. On a more personal level, there has been a stark increase in incidents of family violence, mental health issues, and burnout faced by frontline workers during this pandemic. Singapore has also faced severe economic losses, primarily for the aviation and tourism industry. Various institutions have also made major adaptations due to high-risk settings of contracting the virus, for example, home-based learning for schools. Due to these major impacts, the livelihood of individuals has been greatly compromised, causing high rates of retrenchment, as well as financial instability for both employees and employers. I will now be providing a brief scope of vaccination in Singapore. There are 3 types of vaccines available: Pfizer, Moderna, and Sinovac. These are collectively safe for those aged 18 years old and above with the exception of Pfizer. However, for mandated vaccinations, we will be pushing for standardization across all vaccines, hence only individuals aged 18 years old and above will be eligible. Medical clearance is then required, where individuals have to provide health declaration or past medical history, as well as other prerequisites. Medically ineligible candidates will be turned down at vaccination centres, and this may also be a reason that contributes to 20% of the population being unvaccinated. Once both doses have been taken, and after 2 weeks from the second dose, an individual will then be deemed fully vaccinated. The main purpose of vaccinations will be to reduce symptoms of COVID-19, minimize risk of transmission, and hence allow us to provide more focused support for severe cases.
I will now go over the thesis justification. As announced by the government, Singapore is now in transition towards COVID resilience and hence an endemic COVID-19. Mandated vaccines provided through means such as childhood immunization have proven to be effective for coping with previous outbreaks such as chickenpox and polio. Singapore is working towards achieving herd immunity, which reduces the risk of large outbreaks for the community's collective benefit. It ensures sustenance for frontline workers and the healthcare sector, which leads to reduced workload as the sector continues to manage COVID-19 as an endemic condition in the long term. We also acknowledge that despite the vaccine being voluntary, there have been high rates of vaccinated individuals at around 79.9%. However, we want to continue to push for all medically eligible individuals to be vaccinated for the following reasons. Increasing variants put vulnerable groups at risk such as children and have led to a rise in cases, and rising number of deaths and severe cases in the ICU and/or requiring oxygen supplementation. Mandated vaccination will then help to reduce symptoms of those at risk and in turn lessen the burden on the healthcare system to promote sustainability for the sector. Next, we will analyze this matter using various theories and frameworks, as well as elaborate more on our justification for advocating compulsory vaccination in Singapore. First, we'll talk about the Sociological Imagination Framework, or SIF. Looking at the historical factor, the SARS virus in 2003 can be a good example for Singaporeans to learn from and to understand the importance of vaccinations to protect our citizens. The Ministry of Health has also introduced immunization programs that are mandatory for both children and adults to provide immunity against the 12 diseases such as tuberculosis, mumps, measles, rubella, and hepatitis B. For the cultural factor, in Singapore, majority of the citizens lean towards herd immunity. Herd immunity refers to the majority of the citizens getting immunity against the disease, reducing the spread within the community. This in turn leads to collectivism, which refers to the practice of focusing on the safety of the majority instead of an individual citizen. Looking at the structural factor, the Ministry of Health has imposed vaccination status restrictions for citizens in order to minimize the virus from spreading further within the community. Unless fully vaccinated, citizens have to abide by restriction rules including no dining out and no mask off for recreational activities such as gyms and spas. Fully vaccinated citizens will be allowed more freedom but are still required to maintain safety practices such as wearing of face masks. Additionally, the Ministry of Health is pushing for various sectors to be vaccinated such as our frontliners.
Next, I'll be covering the portion on functionalist theory which further advocates for vaccination to be compulsory. The functionalist theory mindset assumes that there is a presence of a social consensus within societal members as to what is good for everyone to have and cooperating to achieve it. Hence, everyone should play a part in society. The theory also views society as a network system with interrelated parts working together, and therefore, all members of society should know what is expected of him or her and abide by it. It is also based on social structures such as social behaviors and social norms. Functionalists will argue that it is a citizen's role to cooperate with the MOH guidelines to help minimize the spread of the virus. As the government is certain that the COVID-19 pandemic is not going to end anytime soon, they are pushing for Singapore to progress into an endemic COVID-19 where we simply treat it as a common flu. Therefore, the government strongly encourages everyone to get vaccinated to reduce transmission as well as the severity of the symptoms, which can in turn lead to lower COVID-19 related hospitalization and even deaths. The concept of herd immunity also explored the fact that there may be a minority who are unable to be vaccinated due to valid reasons such as medical ineligibility or age limitations. However, if majority of the citizens are vaccinated, it can lower transmission, indirectly protecting this minority of individuals who lack immunity. Functionalists will hence argue for those who are eligible to get vaccinated. Lastly, on the concept of functional interdependence and organic solidarity. Singapore being an advanced and diverse society, we have many forms of specialized labour causing individuals to be dependent on one another. Due to the government-implemented measures for COVID-19, unvaccinated individuals may not be able to attend work, hindering society's smooth workflow. For example, if you were a bus driver and are unable to attend work as you are unvaccinated, many others' daily workflow will be affected, possibly due to the delay in public transport timings now that there is a lag in the number of drivers. Hence, functionalists would push for compulsory vaccination to ensure that everyone can continue to play their part in society. Therefore, all in all, we should be able to tell by now that functionalists will advocate for vaccines to be mandatory.
We will next be analysing the thesis statement from the conflict theorist point of view. Conflict theorists will be advocating for no compulsory vaccination for citizens who are medically unfit. A conflict theorist will have the perspective that a differential distribution of power and authority in society creates social divisions, which gives rise to conflict and hostility between social groups. In this context, the government are the ones in power and authority, and to achieve their objective in making COVID-19 endemic, they mandate that all citizens are to be vaccinated. The unvaccinated individuals who are medically ineligible for vaccination are the marginalized group. Therefore, conflict theorists will be advocating for the exemption of mandatory vaccination for the medically unfit. This is done to protect them from the risk of undesirable side effects. Currently, the medically unfit individuals are those who have a history of allergic reactions or anaphylaxis to mRNA COVID-19 vaccines, and also those who are severely immunocompromised.
Although exemptions have been made to people who cannot take the vaccine, the impact of social restrictions on the unvaccinated group should still be addressed. As of now, there are still restrictions for the unvaccinated, such as no dining in or going to the gym. Mandating vaccination would prevent these people from socializing. This leads to another issue of social isolation. We believe that measures should be put in place to prevent social exclusion. One of our recommendations is to provide a special trace together token to those who are ineligible for the vaccine. On top of the current existing functions, it notifies the individual if he or she were about to enter hotspots or high-risk areas. Should they be detected in these areas, they will have priority for quarantine and medical needs. Hence, the unvaccinated would still be able to participate in social activities with extra precautions put in place. To address vaccine hesitancy, we recommend that official representatives make vaccination house visits for these people. According to a 2015 article, inadequate or poor immunization program communications can increase vaccine hesitancy and outright refusal. Misinformation is one of the reasons for vaccine hesitancy. Hence, with this measure, we hope to target any issues or concerns these people may have and eventually improve their acceptance of the vaccine. Due to its magnitude, COVID-19 has become a macro issue which impacted the country in many ways. Currently, the government is moving towards treating this pandemic as an endemic and therefore stressing the importance of herd immunity and living with the virus instead of eliminating it. Based on social imagination framework, Singapore is understood to be relatively accepting of the vaccine. In a functionalist view, citizens have a role to play to ensure the country progresses into an endemic nation. In a conflict theorist view, the exception needs to be made for the medically ineligible group. For these reasons, we support the mandating of vaccination for eligible citizens with the exception of the medically ineligible to avoid putting them at risk.